Good morning, everyone. Dr. Christine Smith here. I have a guest for you today, and we're going to be talking about chronic stress and how that affects your gut, your brain, and your hormone health. And I'll be bringing on Dr. Christy Tompkins, who is a naturopath, and she actually specializes in things around chronic stress and women's health. So I'm going to go ahead and invite her on here. All right, so she really important topic. And I know I've talked about it in various forms before, but it's one of the things that I absolutely get the most questions about by far. And so I just want to address it because it's something that we all deal with, especially in today's world. Hi there, Dr. Tompkins. How are you?
I'm good. Christine, how are you?
I'm good, thank you. So I was just kind of telling people a little bit about you and just pointing out that chronic stress and its effect on these body systems, I think, is one of the most important things that we can talk about because it affects all of us. And it's something that I think is really not understood as much as it needs to be, especially with the significant amount of effect that it has on our other body systems, even down to the fact of like feeding the dysbiotic microbes in your gut with the actual chemicals that are produced in your stress pathways. And we can dive into that more. But I would love if you would just introduce yourself a little bit and kind of what got you into the realm of really wanting to work with chronic stress and these kinds of things.
Yeah, thank you. I'm so excited to share with you. So my niche or my specialty is women's health and hormones. And I have treated women from, teenage years, 20s, 30s, up until menopause. And one of the things that I have seen that has impacted women's health and their hormones, their cycle, and the cycle, by the way, is not just when you're bleeding, it's the whole month, is stress. And stress could be, you're emotionally distressed about something. It could be your diet could be, you just talked about the gut microbiome, your diet could be stressful to the body. I mean, it could be, you could be sick, and that's a stressor to the body as well. And one of the things that it does is it interferes with the normal follicular luteal phase of a woman's cycle. So either she doesn't get a period at all, and kind of in extreme cases, and that actually happened to me when I was a teenager and in my 20s, is I was under a lot of stress and I just stopped getting a period altogether, not knowing what was happening, thinking that was kind of normal. I mean, it was for a certain period of time as I was just getting started during puberty, but for a lot of women, it'll affect the amount of bleeding, their symptoms when their period, their symptoms right before the period, like PMS, premenstrual syndrome. And so, but also for perimenopause. So I treat a lot of perimenopausal women. And as those hormone levels are already starting to drop in preparation for menopause, when the menstrual cycle completely stops, a lot of perimenopausal women, if they're under stress, their symptoms are that much worse. But the hormone levels are also dropping, and then you add in stress, and then cortisol, one of our main stress hormones, comes into play. And it can lower that progesterone even further. It can make women a bit more estrogen dominant. It can lower the testosterone. Thyroid gets affected as well. And then it creates this vicious, perfect storm for women. And they don't realize that stress will affect the hormones as significantly as it does.
Absolutely. That was beautifully said. And I'm so glad that you like to talk physiology, because that's like what my channel is all about, right? Is teaching people how their bodies work so that you can have an understanding of how to live in a more sustainable way. Because if you're always feeling like you have to be fixed from the outside, sometimes that can be really disempowering. And I want to also bring up one of the other things you said, excuse me, is that it affects testosterone as well. And that is in women and in men. So I know, like, she just mentioned a bunch of stuff about the female cycle, but men, this affects you too, or women, this affects your partners as well. So like, just keep in mind that it affects us all in the way that basically our stress pathways share building blocks with our hormone pathways. And so if we are constantly running our stress pathways, it utilizes the resources that we might be using towards our sexual hormones, towards our thyroid hormones, and a whole bunch of other stuff. And if I was to just dive into like a little bit of a basic physiology lesson around that, I think one of the most common things that people may have heard of is something called the cortisol steal. And there's, you know, theories around it that it's not actually a steal and getting kind of nitpicky about the language. But ultimately what it means is that your resources are being used for stress instead of your hormones. And then there's also a component of an amino acid building block called tyrosine. And tyrosine is a building block in your stress pathways, and it builds things like norepinephrine and adrenaline. And so if you are constantly in a state of fight or flight or chronic stress where you're just, and when you've been in that state for a long time, sometimes you don't even realize that you're there. And if you're in that state all the time, you're constantly shoving all your biochemical pathways and your use of tyrosine down those pathways, rather than using tyrosine for things like building your thyroid hormone or building your dopamine, which is your motivation chemical and has a lot to do with happiness and pleasure. So it's just a really interesting thing where all of these things are intermingled. They're not separate. And the cholesterol component that goes into your sex hormones and like the testosterone or other sex hormones that she was talking about, that applies to men and women. The tyrosine thing applies to men and women. So, but for women, sometimes it can just be a little bit more of a drastic effect because of everything that she was talking about, because we have such a complex cycle throughout the month and our hormones go through so many more fluctuations. So it can just be, you know, why it can often affect women more. So I'm sure you have your 2 cents on that, and I'd love to hear your thoughts.
Yeah, you know, you bring up a good point, and I actually think about this quite a lot. I mean, there's very significant differences between men and women, you know, physically, but hormonally as well. So men traditionally produce a lot more testosterone, a lot more thyroid hormone, a lot more human growth hormone. I mean, their mass size is bigger, and so to say that men can usually withstand a lot more stress than women, I would say that's not the case for every single man or woman, but I would say because of the abundance of hormones. I mean, think of it as kind of a buffer or cushion. When we're younger, when we're in our teen years, we have a lot more hormones, and also well. So I think it does affect men, because you're right, it does interfere with that testosterone production, because for men and women, because your body is under some sort of threat, and your body isn't thinking about procreation. It's not thinking about being relaxed and calm and in a nurturing state. It's in that threatened mode. So it's going to do whatever it can to funnel your resources or your energy to your muscles and to your cardiovascular system and to your respiratory system, your lungs. And so temporarily that's okay. The body knows what to do, but over a long period of time, the body can't keep up with those demands.
No organism can.
It can't. And then it starts to deteriorate. It starts to break down. And that's when you start to see illnesses and chronic inflammation. And inflammation's a good thing, but chronic excess inflammation obviously is very destructive to the body. So over time, the cells start to become dysfunctional and irregular, and then all of a sudden things don't work quite as well. But also kind of talking about nutrition and what you put into your body, and the foods you're eating, and maybe the supplements you're taking. You could be eating extremely healthy and getting, you know, lots of vegetables and healthy sources of protein and fat, and maybe taking all your supplements. But if you're under a lot of stress, your body's not going to absorb it very well. So it does help for sure. And I definitely am a huge proponent of healthy diet and taking the right supplements to help you cope with stress in certain ways. But it almost makes it so that your body isn't able to assimilate and absorb that under the times of chronic stress.
You just made one of my most favorite important points, which is that absorption is affected and your gut health is drastically affected. So like if you're running from the tiger, your body's not really focused on absorbing foods at that time. It's also not focused on libido. So this is why when you're in states of chronic stress, you can lose your appetite for intimate interaction, and food. And there's this really interesting thing that can happen basically. So stress, right, it is a very, very, very mental stress, emotional stress. It's a very, very similar chemical and inflammatory pathway to if you were to get injured, like if you were to break your leg or hurt your shoulder or get in a car accident, any of those things. It's a very similar pathway. And when that happens, our immune system and our body's response basically turns on to be able to resolve that. And that involves basically tissue permeability so that our cells and our white blood cells and our immune system can move around. Now, that also involves gut permeability, which means that when you sprain your ankle or you get super emotionally stressed out, you actually get a little bit of leaky gut. And so not only are you now unable to absorb your food as well because your gut just isn't functioning in the same way, but it's also now a little bit more permeable, and you can actually have little food particles that leak through, and then your immune system accidentally starts attacking those food particles because it's already upregulated, because it's trying to fix the stress pathway and like the injury that you have, even if it's a mental emotional injury. And I think it's something that's quite misunderstood. And that's why there was a story of a guy who like fell off a ladder and all of a sudden became lactose intolerant. And people are like, we don't understand how this happens, but we're starting to understand how this happens. And this is why you can have super stressful event in your life and then all of a sudden become really sensitive to a bunch of foods. And especially if it's like compounded. Let's say you get in a car accident and you have an emotional stressor, or the car accident in itself was an emotional stressor because of the way that it happened. If you have both of those, the effects are even more drastic. So now we have the malabsorption. Now we have a little bit of leaky gut. Now we have an overactive immune system. And then in addition to that, there's this interesting fact that a lot of people don't know, that the dysbiotic, this is the thing I mentioned at the beginning, the dysbiotic bacteria in your gut, which are usually gram-negative bacteria, which means that they are a strain of bacteria. This is like Yersinia and E. coli, things like this, which, you know, we all have them. They all live in our gut, but the rest of our microbiome is kind of supposed to keep them in check, and we're not supposed to have drastically high levels. Those bacteria actually feed on things like adrenaline and norepinephrine, and they have receptor sites for them. And there are scientific articles about that in like the Journal of Endocrinology. Like, this is a known thing. So that means that if you are super stressed out and you're having an adrenaline response, not only do you have leaky gut, so stuff is accidentally leaking into your bloodstream now, but we're also accidentally feeding the bad bacteria. And now you're having this like blossoming of all these bad bacteria that produce a bunch of toxins with leakiness in your gut, which means those toxins are getting into your bloodstream, which means that we now have subclinical levels of endotoxemia, meaning like accidentally poisoning yourself from the inside. And then that can go up to your brain and it can cause brain inflammation. And then we can start to deal with like really weird levels of anxiety and depression and all that stuff. And I know you also work with brain health, so I'd love to hear your thoughts around that.
That was beautifully said, by the way.
I've done a lot of research on it.
Like, I love piecing all the different body systems together. I mean, it's a mystery.
Not separate.
It fascinates me how everything is tied, the system-based approach to evaluation and treatment. So yeah, you're right. I mean, the body, that's an adaptation state. It's a maladaptive state. But what's interesting about stress is it's not just something that happens to us, or we often bring it on ourselves, usually, not always. But it can become addictive. It actually can become this almost like, you know, a food or drug or coffee or something that you are chronically addicted to. We can become addicted to the hormones of stress. A lot of Dr. Joe Dispenza talks a lot about that, and other spiritual leaders and teachers, and he's a chiropractor as well. And he, the chronic stress cycle becomes so ingrained in us that we don't even know the difference. We don't even remember what it's like to be happy or to live a calm life anymore. And it's realizing and kind of stopping yourself in those cyclical patterns of overreacting and chronic stress, and somehow breaking out of that and realizing that you don't have to stay stuck in that cycle anymore. But like you just said, a lot of times we are poisoning ourselves with our own stress reaction and our own stress hormones. And yes, it will affect every cell in the body. It's not just, I did just a brief Instagram reel on this the other day about how, you know, the chronic or the acute stress response is pretty universal for humans, you know, the heart racing, and the dry mouth and the perspiration and maybe a tightness in our gut, but it also can be systemic, like you said, the intestinal permeability or leaky gut. And chronic pain which is interesting because cortisol is anti-inflammatory, but to a point, when it becomes excess, it's actually excessively inflammatory. So it causes chronic pain in the muscles and the joints and the tendons. But another perfect example of this is that it'll affect your skin, like eczema, psoriasis. I've seen so many patients over the years that have severe eczema. Psoriasis is a little different, but those are also very pro-inflammatory conditions on the skin as a result of something happening on the inside. And a lot of times it will instigate the reaction on the skin, the inflammation. But then when you're chronically stressed, it actually makes it worse. So it is that perpetuating cycle of it possibly was caused by chronic stress and now it's worsened by chronic stress that we're doing to ourselves. And again, it doesn't have to be emotional stress, and there's no bad emotions or feelings, no judgment, because that's just part of the human experience is experiencing all those emotions. But when it starts to break down the body and actually cause problems, that's where it becomes problematic. And unfortunately, as you know, a very common response to excess inflammation is corticosteroid hormones, like prednisone, whether it's internally, it's something that you inhale through like an albuterol inhaler for your lungs, or a corticosteroid prednisone cream for eczema, something that you can take orally for autoimmune conditions, excessive inflammation conditions. And it's just, again, that's perpetuating that cycle of too much cortisol, suppressing inflammation, and then making the problem worse.
Yep. Oh man, you just stated all that so beautifully. And I just saw a question where someone said, can a baby be born with leaky gut if the mother was chronically stressed? I'm going to say, in a way, yes, because if mom's microbiome is affected by these states, that is passed on to the infant during both pregnancy and during birth and breastfeeding. And so like there's this, we're still coming to understand that stuff. Like it's so complex. To think that we know everything about the human body is naive. Like we are still learning so much all the time. And we used to like, there, like not too long ago, and even nowadays, there are doctors out there who say that like leaky gut isn't real, and there's so many studies to counter that. So it's just, we're always learning stuff about it. And I love what she was bringing up about the skin. Like one of the things that I think, another thing that I think people don't know that I think is super cool is that your skin and your brain tissue come from the same place embryologically. They both come from the ectoderm. So to me, that means that your skin is an extension of your brain. So if your skin is inflamed, it is likely that your gut and your brain are probably also dealing with some inflammation. And then like she was talking about, if you have a whole bunch, if you have like a skin thing going on, like a rash, and it flares when you get stressed out, that means it's probably tied to a little bit of stuff going on in your gut. And the other thing I want to bring up is like, I know we're challenging people here a little bit, and we're challenging you to realize that you have a role in your own health, and also challenging you to set aside feeling like a victim to your environment and realizing that you can actually have an effect on it by changing how you perceive things. I am not saying that this is an easy thing to do, and but I just want you to know that it's possible. And that's why I do these talks, is so that people can have their minds opened instead of only being stuck in one system and one paradigm that basically says that like you have to be fixed by an outside source. And there is so much cool research going on right now with like people who dive deep into meditative practices and end up reversing different conditions that they were told could never be reversed or weren't being affected by medications. And that has to do with basically using your brain as a pharmacy. And you just have to be trained on how to do that. I will say, if you are in a chronic state of fight or flight, it's really, really, really hard to do, because it's kind of like seeing the picture from inside the frame thing. It can be beneficial to get some outside help. And this is where like body work can be really cool, because it can help to break that cycle and kind of bring you into a calmer state. Or there's like really cool technologies out there. Like I just did a reel the other day for like the Denver Zen Den, and they're basically using biohacking technology with like different kinds of light waves, or like vibrational, like what do they call it, somatoacoustic therapy. It's basically like listening to music while vibration is also playing a role in that, and it brings your body into this meditative state, and it kind of breaks the chronic stress cycle so that you can remember what it feels like to be calm. And then it gives you this map that you can work towards when you are doing practices like meditation. So for anybody who's really struggling out there, I want you to know, like, my heart goes out to you. And I'm not saying that this is easy, but I'm saying that it's possible to give you some hope and some power back. So just wanted to address that.
Yeah, that was eloquent. And I loved everything about how we have our own internal pharmacy. I mean, we really do have this self-healing body that can do miraculous things. Really miraculous, because it's just part of the human body. But we have so much power and so much ability to heal our bodies. And I've gotten into meditation pretty consistently over the last few years, and I have experienced some profound things in my life with regard to chronic stress, and with regard to some physical health symptoms that I was struggling with. And we have that ability to shift from the sympathetic nervous system, the fight or flight or freeze, to the parasympathetic, which calms us down. And I love meditation, and I don't just sit there. I think that's really difficult for most people, to just still the mind, because you can't. We're human. So pairing it with some sort of meditative voice with the music. I'm a huge fan of sound healing. I love sound healing and how it impacts the brain and the brain waves, going from high beta down to alpha, stimulating alpha brain waves, down to theta, and then in some cases gamma. And that ability is amazing at interrupting that stress pattern, not just for that moment, but if you do this consistently most days, or at least several days a week, and it doesn't have to be an hour, it could be 15 or 20 minutes, that's enough to heal the body. And I love the fact that it, like you just said earlier, like, you don't have to go outside of yourself. Sometimes we do. I mean, we do need help. Mm-hmm. And sometimes we do need medications, and we need surgeries. And obviously, if we have a life-threatening accident, we need to go to the hospital.
It's about joining them.
Yeah, it's the integration. It's the synergy. It's the symbiotic, kind of using what you can, what you need to allow your body to heal.
And different people need different things at different times.
Totally. And it's knowing when to go for something a bit potent temporarily, and to go for something not quite as damaging to the body, and to just remember that you do have a lot more power than you realize with regard to healing your own body. And I've seen testimonials, or I've listened to testimonials from people who have been able to transform their lives, and it is really a miracle.
Yep. And it's so funny, because I know I talk about like energy a lot on this channel, and I just want people to know, like, I've also worked in multiple research labs. Like, I'm a very left-brained person. I'm a very data-driven person. So everything that I look at, even when it's in the more like right-brained energetic realm, is really, really data-driven. And so it's like, this stuff is out there, and it's happening no matter what you think. So like, I just want you to know those things about it. And then I also want to come back to something you said earlier, because I think it's a really important concept for people, is understanding that you can become addicted to a state of being. And I'm not saying like this is bad, or this is black and this is white. I'm just saying like, this is a thing that can happen. And you can literally become addicted to being depressed. You can become addicted to being anxious. You can become addicted to overreacting. because it's what your body views as what's called homeostasis. So if you've been doing something repetitively for like the last 5 years, 10 years, 20 years, whatever, your brain starts to form these neural pathways. And I compare it to like, it's like water running over the ground. At first, a pathway is like really kind of messy, but then as it runs through that same rut over and over and over again, it gets deeper and deeper and deeper, and the water is going to go there more often. Same thing with your neural pathways. The more you activate a neural pathway, the more easily it will become activated. So if you have a tendency to be an anxious person that overreacts, that's going to be your tendency, and it's going to be really, really hard to break. And I've even, had to work on this myself. I've been practicing meditation for like 10 years, and I literally just had to do it this morning. Like I meditated this morning, I felt great. Something like threw me onto an old pathway, and I was like, why am I all irritated right now? But now with these practices of like really observing myself, and that's what the practice of meditation is. Like, yeah, it's hard to sit there and like have your mind be quiet. That doesn't happen to anybody really. It's more like sitting there and being able to watch your own thoughts and being like, oh, like that's an interesting pattern. And now I've done that enough where I'm like, I'm irritable, but I don't think it's what I think it's from. Like, what is it actually from? And then I can go in there and be like, oh, I got flipped onto an old neural pathway. Okay, let me go like sit down for 5 minutes and flip on to the one that I want to have, which is like feeling very calm and feeling very present and coming back to this thing that I'm practicing. And the thing that I'm practicing is newer than the really old stuff from when I was like 6 years old, right? So it's taking time to make those grooves and make those ruts. But the more often I come back to it, the deeper those ruts will become, the easier it will be to do. And so this is really the practice. It's physical therapy for your brain. That's what meditation is. It's physical therapy for your biochemical system of your body. And it's just a practice. So, but I think the addiction component and then the other piece I wanted to say on that is if you have been dealing with that for a long time, there's probably a reason that you developed that. It was probably a safety mechanism in some way. So there's also this really weird thing about maybe being anxious or maybe being depressed or maybe overreacting that's actually protective for you. So then you get a sense of discomfort when you're not anxious because you feel like you've missed something and you're not safe because you're not protecting yourself by doing that thing that used to protect you. And when we can start to bring this to your conscious mind's awareness, then you can start to realize like, oh, you know what, body, like, thanks. I know that you're trying to protect me, but that's not like that situation isn't alive anymore. That situation's not real anymore. I want to change how I'm being. And now I'm making a conscious decision to do that. So for anyone who hasn't heard those concepts before, I just wanted to bring them to light. And I think that's exactly what Dr. Tompkins was touching on too. So I'd love to, yeah, please go for it. I could see you like sparkling with ideas.
Yeah, I would say most people don't know that. I mean, you just said maybe you've heard this before, and that maybe people have read about it online or listened to a podcast or an Instagram live, but it's not common knowledge to know that your body not only can be addicted to stress, but it actually is craving it, and it actually wants to go back to that state because it's familiar, it's the known. It's almost like you said, neurologically, your brain wants to go that way. And not a lot of people realize that. I think it's one of those things that, we think about something from the past and we have an immediate reaction, or we're worried about the future and we have some sort of response to that. And I think, it's the brain is so complex, and it sounds like you know a lot more about this through your training than I do. I'm fascinated by it, and I'm learning more and more about the neural circuitry of our brain and how it all functions, not just in working with our body, the rest of our organs, but also how we can change our behavior and how we can change our thoughts and how we can therefore change our life because of just, again, like another beautiful pharmacy located up here. One of the important things is kind of just continually bringing yourself back to this present moment, this present, which is so tough for all of us to do because of, especially today, we have so many distractions and so many devices and so many things that we have to do, far more than thousands, millions of years ago. And so our body now has to take on a lot more things, and it has to juggle a lot more things. And that's so easy for all of us to get distracted, but constantly, and that's the beauty of meditation, is it brings brings you back to that still present moment so that you can actually focus on things you actually want in your life, but you can also get creative. And that's the beautiful piece of the present moment, is you can actually start to create a personality, a response, a life that you want, heal your body. One of the things you mentioned earlier about, do we have this, is this something that we've been dealing with for a long time? And I went to this seminar a few weeks ago with Bruce Lipton and Ray
Nice.
Grace, The Science of Resilience, and loved it. And they showed this quick, of course, beautiful presentation for the whole weekend, the two of them, about how you can adapt and change your life for the better. But they showed this brief clip on this baby in utero, and they had an image of the parents fighting, and they were arguing, and it showed, I guess, somehow the mother reacted, or she did something, or she screamed, or maybe the husband screamed, and the baby kind of jumped in utero, and it showed this. And so, yes, I do think the baby, a lot of times our stress response, our depression or anxiety or whatever emotions or emotional distress, if our mother is feeling that, yes, I think it is very likely, and I'm sure there's a lot more research than I have dove into, but babies can respond to that, just like children in that environment can become immersed in that, and it becomes familiar, and they also become addictive. And when you can realize that your story, or the story that you're playing out, may not actually be your story, it may be your parents' story, or your parents' reaction, but it can also be your own. It could also be your own from whatever experiences have happened to you. But a lot of times I think we are playing out a story that isn't even ours.
Yep. Oh, that was wonderfully stated. And for anybody, so I saw someone ask, like, do we have a podcast? Would love to hear more. I pretty much treat this Instagram like a podcast, because, and the reason I did this is so you guys can ask questions, because I love getting to answer questions live. I think it's something that's kind of missing sometimes. So there's tons of stuff on my channel. I know Dr. Tompkins has a bunch of stuff on her channel as well. But anything with a title page on my feed is an interview like this. That's basically a podcast. So that is there.
I am actually,
yeah, go for it.
Yeah, I'm starting a podcast. I haven't launched it yet, but I have everything in place. It's called Fire, Soul, and Grace. So I have everything. It's just, I'm working on another program right now, which I'll talk about in just a minute. But I'm definitely going to be launching a podcast. I love the Instagram lives because it is live. I mean, it's in real time. Podcast is in real time, but then it's recorded and edited and then published, and was cool too. So I have mine coming out. I'm excited about it, and I think you should host a podcast.
It's been in the works for a while. I do a lot of things, so it's been on my to-do list. But yes, I've had a name for it for a long time as well, so I'm working on that too. But for anybody, like, the reason I'm such a neuro nerd is because my background is cognitive neuroscience. Like, that was my study. And I have worked in labs around like cognitive reserve and neurodegenerative diseases. I've also worked in psych labs. And one of the projects I worked on in a psych lab, one of them was actually Burning Man. That was cool, studying Burning Man and studying the emotional effects that people get to have from going to that, which is basically like a huge emotional transformation from having a space where they can just freely express themselves. And the other one was studying how women react to different images based on their trauma history. And that was with fMRI. So we're literally studying the neuroimaging of different parts of the brain that are activated when people who have had certain types of events in their past are shown certain images. So this is why different people can react to the same situation so drastically differently and have a different chemical response. But things that we're talking about right now, meditation, that's kind of, it takes a lot of work and a lot of personal work and a lot of open-mindedness. But that's kind of like some of the stuff that you can work towards. So really cool things that you can work towards. Now, if you're more in the beginning of your journey, that's where participating in something like Dr. Tompkins' program might be really helpful, because I think she goes over a lot of different things like nutrition and gut health and kind of starting more in the body realm and hormones. And so I'll let you like talk a little bit about that. And then I also saw someone saying like, I want to learn more about this. I just posted this in my story, but I'll post a reel for it later. I was honored to get to be a part of a free docu-series specifically about like chronic stress and pain and inflammation. And all of the new practitioners that are just completely changing the paradigm around how we approach this stuff, and not just like using OxyContin to get rid of it, right? So just know that that's coming out. It's called Strange Pain. It's free. So I'll put a link up. You guys can sign up for it. You can also access it through the link in my bio. And that's going to be like a whole bunch of information on this stuff from a bunch of different people. So really, really cool. Just want you to know it's coming out. But Dr. Tompkins, I'd love if you talk a little bit about what you have coming up, because I think you're also providing some education and then have a course, you said?
Yeah. So I have a one-on-one practice where people can consult with me online. So my business or my practice is completely online. So I have a one-on-one 6-month high touch program that I in practice for 15 years. So it's the culmination of all my experience, different lab tests, hormone testing, gut testing, food sensitivity panels, of blood chemistry, a full comprehensive blood chemistry analysis. I love the data too. I have found over the years that I love comparing the symptoms with the data in the lab test because they don't always match.
Yes.
Not only in mainstream conventional testing, which can be pretty limited, as a lot of people have probably experienced, but even the functional lab, sometimes that doesn't always show what's happening with the person's body. So I love to compare the two. So I've got that program in place. And then I'm actually launching an online group health women's program. It's called the Wild Collective. And it is about, it's about gathering women together. It's all online, so you can join from anywhere. And we're going to talk about thyroid health, gut health, brain health, sleep, stress, thyroid, if I didn't already say that. Kind of just more in a feminine, energetic, supportive, collaborative community, but also emphasizing the power and impact of community and how that can empower us, how it can not only support one another, but it can also make us healthier. I mean, talking about stress and the nervous system, when we are in community, whether it's online, Dean and I belong to a coaching group with one of our mentors. It's completely online. I got the opportunity to meet her in Arizona at an in-person event called Mindshare. But the online experience, whether it's in person or through a group program, coaching program, I think that is completely invaluable and completely nourishing to our soul to know that we can go through this journey of health education, learning more body awareness in the environment of community. And so that is starting in a couple weeks. I'm hosting a free live masterclass today at 2 p.m. Pacific Standard Time, 2 p.m. Mountain Standard Time, 1 p.m. Pacific Standard Time. It's on my website. It's on my Instagram bio. And that's an info session, so you can learn more about the program before you sign up.
Awesome. Well, and you know, you guys, this is why I love interacting with the different doctors I bring on my channel, is because I feel like we're all kind of in this mindset where we want to evolve our system. We want to evolve our healthcare system and just provide people free education and give you options. Like, not everyone's ready to come into the office. So that's why we do these things, is so like, if you want to do stuff at home, you now have some knowledge to work with. And if you like want to take a next step, then maybe you like go to the free masterclass or watch the free docu-series. And if you want to go the next step, you participate in the group program. So it's like you have options for anything that you need to do. And I couldn't agree more with what she was just saying about healing and community. I know something I've done for myself, and I've posted a reel on this before. I used to be very contained and, making sure that I was always not offending anybody around me by being myself, which is just not the most realistic place to live in a healthy way. So something that I have started doing for myself is going to an ecstatic dance community. And for anyone who's never heard of that, it's pretty much just a place that you go to move to music in whatever way you want. You can stretch in the back. You can sit there and watch other people. You can dance your heart out and there's no wrong steps, or you can like literally just watch everybody else. And there's tons of men there too. And it's really cool. The one I go to is actually nonverbal. So it's like you don't speak and you're not necessarily like dancing with people unless you want to. You're just there. You're just in presence and in community. And like the men will like come together in the center and kind of have this like masculine moment of like sharing masculine energy, or the women will kind of do the same thing. And it's just completely fluid and like in your own space. And these exist in almost every city. So if you're someone that needs like an in-person thing where you can just go and kind of let your energy do whatever it needs to do, that's a really cool thing. And a lot of people don't know that it exists, or they think it's like some super duper hippie thing. And I guess like it has some hippiness to it, but me, the scientist, like I love going. It's been a really healthy thing for me. So just know, like, if you need something in person, you can do that. And at the end, sometimes people will share, and there's this little 12-year-old kid there, and he shared, and he's like, I'm so glad that I got to do this and spend time with my dad and just move to the rhythm. And then someone else said, humans are meant to heal in community. And that in itself is healing, or participating in the group that she was just talking about can be healing, because then you are not so alone. And that's why I participated in the docuseries when they reached out. And like, I also run group programs for exactly the same reason. So if you guys ever need extra support, like just go to the links in our bio and it has all the information for it. Or if you just want to keep watching these videos, that's fine. And there's a ton all over my feed. Anything with the title page is an interview like this. So that's why I do them. It's just for you to feel supported wherever you are. So anyway, thank you so much for taking the time to do this. This was a really awesome conversation. I loved it. Do you have any like last like thing, like what's something that you just want people to know, or like a last thought that you'd have, or anything like that?
I loved what you said about the aesthetic dance and just showing up as you are. I mean, there's no verbal communication, but you're just showing up as your authentic self. And that's what I love about the group programs, or even just one-on-one care. Like we want you to show up as yourself, because if that's who you are, that's the beauty of who you are, and you want to ascend or get to a better level or become stronger or support your gut, or learn about meditation or learn about how to have better energy. I think reaching out and in this community environment, whether it's through social media or directly with, you know, Christine or myself, I think that community it holds this amazing power to heal, and we're not supposed to do this alone. And that's one of the emphasis of the program I'm hosting, is that we're not meant to be alone. Neurobiologically, we are supposed to collaborate in groups and be part of a tribe or a collective, and that's how we actually propel ourselves even further. So this was so much fun, Christine. I love talking physiology, and I love talking about all the different body systems and piecing it together. And you're right, it's still a mystery, and there's still so much we have to learn, and it is humbling, and I'm just excited to be part of this journey. And thank you for having me on your page.
Absolutely. Thanks for taking the time to do this and for helping people learn about themselves so that they can feel empowered. So, and anyone with any questions, feel free to comment, reach out to us. We're always here for you. So I'll look forward to our next talk. I'm sure we can do a bunch more.
Yeah, I'll have you on my podcast, and I'll be on your podcast.
Awesome. Okay. Have a great day.
You too. Bye-bye.